Hey everyone! Welcome back to Diabtron. Today we have an important topic to discuss: how to effectively heal a diabetic ulcer. If you or someone you know is dealing with this, you're in the right place. Before we dive in, make sure to hit that subscribe button and ring the notification bell so you never miss our helpful content on health and wellness. Now let's get started. In this video, we'll cover the essential steps, practical tips, and crucial information you need to know to successfully heal a diabetic ulcer. Whether you're a patient, caregiver, or just interested in understanding this process better, stick around. Remember, knowledge is power when it comes to managing health challenges. So let's empower ourselves and learn how to heal diabetic ulcers together. Are you ready? Let's roll the intro. A diabetic ulcer is a persistent and slow-healing wound that develops in individuals with diabetes, primarily affecting the feet, resulting from a combination of factors such as poor circulation, nerve damage, neuropathy, and compromised immune response. These ulcers present an increased risk of infection and other complications. Often forming on weight-bearing areas, they can lead to severe tissue damage and, if left untreated, may necessitate amputation. Timely intervention involves meticulous wound care, infection control, and addressing underlying factors like hyperglycemia. A multidisciplinary approach, including medical professionals specializing in wound care, is crucial for effective management and prevention of further complications. Timely intervention involves meticulous wound care, infection control, and addressing underlying factors like hyperglycemia. A multidisciplinary approach, including medical professionals specializing in wound care, is crucial for effective management and prevention of further complications. The healing process involves a dynamic series of physiological events aimed at repairing damaged tissues. Following injury or infection, the body initiates inflammation, clearing debris and promoting tissue regeneration. Subsequent stages include proliferation, where new cells form, and tissue remodeling, enhancing strength. In diabetic ulcers, impaired healing arises from factors like poor blood flow and neuropathy. Diabetic ulcers arise from a combination of factors related to diabetes-induced complications. Reduced blood flow, ischemia, and nerve damage, neuropathy. Diminished sensation, increasing susceptibility to injuries. Poorly managed blood sugar levels compromise the immune response, impairing wound healing. Other risk factors include foot deformities, footwear choices, and duration of diabetes. Smoking and alcohol consumption exacerbate these risks. Understanding and addressing these multifaceted contributors is crucial in preventing and managing diabetic ulcers effectively. Regular monitoring and comprehensive care are essential components of mitigating these risks. Diabetic ulcers typically manifest in areas subjected to elevated pressure and trauma. Common locations include the plantar surface of the feet, particularly over bony prominences such as the heels and metatarsal heads. The constant friction and pressure during weight-bearing activities make these regions vulnerable. Additionally, ulcers can develop at the tips and sides of the toes. Regular foot inspections and preventive measures are vital in identifying early signs and averting complications associated with diabetic ulcers in these predisposed areas. Untreated diabetic ulcers pose severe complications, escalating the risk of infection and tissue damage. Infections can spread to surrounding tissues and bones, leading to cellulitis or osteomyelitis. Prolonged inflammation may cause the ulcer to enlarge, increasing the likelihood of complications. In advanced cases, the risk of limb amputation becomes a critical concern. Additionally, untreated ulcers contribute to systemic complications, impacting overall health. Early intervention is crucial to mitigate these risks and enhance the chances of successful ulcer healing. Signs and symptoms of diabetic ulcers encompass redness, swelling, and localized warmth in affected areas. Persistent drainage or discharge, often accompanied by an unpleasant odor, may occur. Pain or tenderness, especially during weight-bearing activities, is common. Changes in skin color and texture, as well as the presence of calluses or corns, can indicate underlying issues. Diminished sensation or tingling in the affected region may also be present. Regular foot examinations are essential to promptly identify and address these warning signs. Initiating a consultation with a healthcare professional is pivotal in addressing diabetic ulcers. A qualified medical evaluation involves a thorough examination of the ulcer, assessing its size, depth, and surrounding tissues. Diagnostic tests and imaging may be employed to identify underlying causes, guiding the development of a personalized treatment plan tailored to the patient's specific needs and circumstances. Cleaning and debridement are crucial steps in diabetic ulcer care. Cleaning involves gentle washing with mild soap and water to remove debris and bacteria, promoting a clean wound bed. Debridement, the removal of dead or infected tissue, facilitates healing. Healthcare professionals may use methods such as surgical debridement, enzymatic agents, or autolytic dressings. These processes create an environment conducive to tissue regeneration, reducing the risk of infection and supporting the overall healing of diabetic ulcers. Regular monitoring ensures the effectiveness of these interventions. Selecting appropriate dressings is vital in managing diabetic ulcers. The choice depends on the ulcer's characteristics, such as size, depth, and presence of infection. Moisture-retentive dressings, hydrogels, or antimicrobial dressings may be used to create an optimal healing environment. Non-adherent dressings minimize trauma during changes, and offloading devices help redistribute pressure. Regular assessment and adjustment of dressing types contribute to effective wound care, promoting the healing of diabetic ulcers and preventing complications. Reducing pressure on diabetic ulcer-affected areas is paramount for successful healing. Elevated pressure exacerbates tissue damage, impedes blood flow, and hinders the body's natural healing processes. Offloading devices, specialized footwear, or orthotic interventions redistribute weight, alleviating stress on vulnerable regions. This promotes optimal blood circulation and reduces the risk of further injury. By prioritizing pressure reduction, healthcare professionals aim to create an environment conducive to healing, mitigating complications, and supporting the overall recovery of diabetic ulcers. Orthotic devices and specialized footwear play a pivotal role in diabetic ulcer management. Designed to alleviate pressure on vulnerable areas, these interventions help prevent further trauma and promote healing. Customized orthotics provide support and redistribute weight, reducing stress on affected regions. Footwear with extra depth, cushioning, and proper fit further minimizes pressure, preventing complications. The use of orthotic devices and suitable footwear is integral in comprehensive diabetic foot care, fostering a protective environment for ulcers and enhancing overall well-being. Infection control is a critical aspect of diabetic ulcer care. Swift and effective measures, including the use of antibiotics or antimicrobial agents, aim to combat infection and prevent its progression. Wound cleaning, debridement, and proper dressing selection are integral components of this strategy. Monitoring for signs of infection, such as increased redness, swelling, or discharge, ensures timely intervention. By prioritizing infection control, healthcare professionals safeguard against complications, fostering an environment conducive to the successful healing of diabetic ulcers. Managing blood sugar levels is paramount in diabetic ulcer care. Tight glycemic control is essential to promote optimal wound healing and prevent complications. Healthcare professionals collaborate with patients to develop personalized plans, incorporating medications and insulin management. Regular monitoring and adjustments help maintain stable blood glucose levels. By addressing hyperglycemia, the risk of infection and delayed healing is reduced, enhancing the overall success of diabetic ulcer management and supporting the patient's long-term well-being. Lifestyle modifications are integral to diabetic ulcer management. Dietary adjustments, emphasizing a balanced and nutrient-rich diet, contribute to overall health and support wound healing. Regular exercise promotes circulation and reduces the risk of complications. Smoking cessation and limiting alcohol intake are crucial in minimizing vascular damage. These lifestyle changes, coupled with diligent foot care practices, create a holistic approach to diabetic ulcer prevention and management, fostering improved well-being and reducing the risk of further complications. Follow-up care is essential for effective diabetic ulcer management. Regular checkups with healthcare providers monitor the progress of healing and allow for adjustments to the treatment plan. Ongoing assessments of wound status, glycemic control, and overall foot health are conducted. Patient education on self-care practices and preventive measures is reinforced during follow-up visits. This proactive approach ensures that any emerging issues are promptly addressed, optimizing the chances of successful healing and minimizing the risk of complications associated with diabetic ulcers. Complications in diabetic ulcer management necessitate prompt action. Warning signs such as increased pain, swelling, or persistent drainage warrant immediate attention. Systemic symptoms like fever or chills may indicate a severe infection requiring urgent medical intervention. Any change in ulcer appearance or signs of spreading infection should not be ignored. Timely communication with healthcare professionals is crucial, as early intervention can prevent worsening conditions, reducing the risk of complications associated with diabetic ulcers and supporting effective healing. Prevention strategies for diabetic ulcers involve proactive measures such as daily foot care, regular podiatry visits, and careful footwear selection. Educating patients on the importance of maintaining good glycemic control, adopting a healthy lifestyle, and recognizing early signs of foot issues plays a pivotal role in averting complications. In conclusion, diabetic ulcer management requires a comprehensive and proactive approach. Early detection, prompt medical intervention, and a focus on addressing underlying causes are pivotal. Patient engagement, lifestyle modifications, and adherence to preventive strategies significantly contribute to successful outcomes. Regular follow-up care and open communication with healthcare professionals are crucial in preventing complications. By prioritizing these elements, individuals can enhance their well-being, mitigate risks, and foster a positive trajectory toward the effective healing of diabetic ulcers. And there you have it, our guide on how to heal a diabetic ulcer. I hope you found this information valuable and that it brings you or your loved ones closer to a healthier, happier life. If you haven't already, make sure to subscribe to Diabtron for more insightful content on health and wellness. Hit that subscribe button and ring the notification bell so you never miss an update. Our health matters, and we're here to provide you with the knowledge and support you need. If you have any questions or topics you'd like us to cover in future videos, drop them in the comments below. Before you go, check out our next video. It's packed with more tips and insights to help you on your health journey. Thank you for being a part of our community. Remember, you're not alone in your journey towards better health. Take care, and we'll see you in the next video. Bye for now!